So, if you see some of the features of obesity, right, what are the complications and what will be the clinical manifestations of obesity. See, first and foremost, the psychosocial. These individuals, they have poor self-esteem and they feel depressed, right. So, psychosocial features include right, they have poor self-esteem, right, and they feel depressed. Next, followed by that, these individuals, the neurological manifestation, they will have pseudotumor cerebri. Now, what do you understand by this word pseudotumor cerebri? It is the clinical scenario where there is raised intracranial pressure, right, and as such there is no tumor, but there is raised intracranial pressure, and that can be one of the complications associated with the obesity. And the pulmonary manifestations in obesity, they include OSA, that is the obstructive sleep apnea, right, because increased soft tissue surrounding the chest wall can compress the respiratory tract when the individual is sleeping, and that can make the individual to develop the obstructive sleep apnea. And they can also have exercise intolerance, right, they also develop the exercise intolerance. Then if you take the gastrointestinal manifestations, it includes the development of the gallstones, right, and there can be development of the steatohepatitis, right, gallstones and steatohepatitis. So, if you see the renal complications associated with the obesity, the individual can develop glomerulosclerosis, right, the individual can develop glomerulosclerosis. These are the renal complications. Followed by that, if you see the musculoskeletal manifestations of obesity, so musculoskeletal manifestations of obesity, it includes number 1, there will be excessive fractures or there can be slipped capital femoral epiphysis, right, slipped capital femoral epiphysis, and there can be compound fractures. So, these are the musculoskeletal manifestations. Then followed by that, if you see the cardiovascular manifestations of obesity, cardiovascular manifestations of obesity includes the development of the hypertension, right, there can be development of coronary artery disease and there can be dyslipidemias. So, this will be the cardiovascular manifestations of the obesity. And finally, if you see the endocrine manifestations of obesity, endocrine manifestations of obesity includes the development of type 2 diabetes mellitus, then followed by that development of precocious puberty, right, precocious puberty. Then in girls there can be development of PCOD, that is polycystic ovarian disease, and not only that, there can be also hypogonadism in boys. Right, there can be development of hypogonadism in boys. So, these will be the features in obesity, right. The neurological manifestations, that is psychosocial manifestations, include, right, the poor self-esteem and depression. The neurological manifestations include the development of pseudotumor cerebri, pulmonary manifestations in the form of the obstructive sleep apnea and as well as the development of exercise intolerance. gastrointestinal, that is gallstones and steatohepatitis, renal manifestations in the form of glomerulosclerosis, musculoskeletal manifestations, that is in the form of slipped capital femoral epiphysis, and there can be compound fractures, and cardiovascular manifestations, that is in the form of hypertension, coronary artery disease, and dyslipidemia, and endocrine manifestations are in the form of type 2 diabetes mellitus, precocious puberty, polycystic ovarian disease, and in boys there can be development of even hypogonadism. So these are the complications or the features that you will see in obesity. Now let me exactly tell you the treatment of obesity. So in the treatment of obesity, first and foremost, lifestyle modification, that is increased exercise, right? Eating behavior modification is very much advised to the individual. Then there should be a supervised low calorie diet that has to be given to the individual, and drug treatment, and finally surgery. So these are the options of the treatment: lifestyle modification, drugs, and as well as the surgery. So let me just take up the treatment of obesity. So after having discussed about the pathophysiology of the obesity and what are the neurotransmitters which are released for the development of obesity, now let me discuss the treatment of obesity. So in the treatment of obesity, right, what are the various options that we have? First and foremost, directly we don't have the medical management as a treatment in case of the obesity. The first line treatment will be the lifestyle modifications, okay? And what will be the lifestyle modifications? This particular lifestyle modifications include, number one, exercise. So this is very important, right? Minimum half an hour to 45 minutes of exercise has to be done, right? And that particular exercise should make the individual to sweat out, okay? So exercise for nearly around half an hour to 45 minutes, and that too 5 to 6 days in a week, right? That is one of the very important lifestyle modification. And next thing is eating behavior. So the individual has to cut down the high fatty diet or high energy rich content, okay? And then followed by that, after having discussed about the lifestyle modification, so definitely eating behavior, the energy rich food or the high fatty food have to be completely cut down, and the individual has to be given supervised low calorie diet, right? The individual has to be given supervised, this is very important, right? Supervised low calorie diet. Then after having discussed about the lifestyle modification, the next important thing is drugs, right? The next important thing is drugs. I'll give you the list of drugs, and I'll also explain you the mechanism and their adverse effects of these drugs used in the treatment of obesity. Then followed by that, if the individual, right, then followed by that, if the individual fails even with the medical management, then the last option is the surgery. Now at which level you need to give lifestyle modification, at which point you need to give drugs, at which point you need to do surgery is also very important. See, when the body mass index of the individual is around 25, right, when the body mass index of the individual is around 25, then the lifestyle modification is very much advised, that is in between 25 to 27 lifestyle modification is being advised. But as the BMI increases beyond 30, right, as the BMI increases beyond 30, right, when the BMI is in between 30 to 40, right, what has been recommended is the drugs. And if the BMI is more than 30, if the BMI is more than 40, then the surgical treatment is being advised in the treatment of obesity. Now, let me first discuss what are these anti-obesity drugs. So, these anti-obesity drugs include, number one, we have Orlistat. right? We have a substance called the Orlistat. Now, if you take this Orlistat, it is a pancreatic lipase inhibitor. So, we have the pancreatic lipase which is being produced by the exocrine function of the pancreas. And what does this lipase do? Lipase will cause lipolysis. It will break the fat into free fatty acids, and the free fatty acids are absorbed across the GIT. Now, what this Orlistat will do is, Orlistat, it is a pancreatic lipase inhibitor. Right, pancreatic lipase inhibitor. What does this pancreatic lipase inhibitor does? This pancreatic lipase inhibitor inhibits this enzyme, and thereby there is no lipolysis. Thereby there is no breakdown of the fat into free fatty acids. So that is the reason why the fat is not being absorbed by this particular Orlistat. Then the next important drug like what we have is the Sibutramine. Right, the next important drug like what we have is Sibutramine. So what is this particular Sibutramine? Sibutramine, it is a serotonin norepinephrine reuptake inhibitor. Right, serotonin norepinephrine reuptake inhibitor. So that is about your Sibutramine. Then the next important drug which is given in the treatment of obesity include rimonabant. Right, we have rimonabant. This rimonabant, it is a cannabinoid type 1 receptor antagonist. Right, it is a cannabinoid type 1 receptor antagonist. So these are the anti-obesity drugs. Now, apart from these Orlistat, Sibutramine and as well as rimonabant, we have some new drugs which have been approved by FDA from 2012. I'll also give you the list of the new drugs which have been approved by the FDA. So, to have a short recap on the treatment, lifestyle modification is one very important way of treatment. That is, it includes increased exercise and as well as changing in the eating behavior. So, in the sense, the individual should cut down the energy rich food and the individual has to consume a supervised low calorie diet. And when the BMI is in between 30 to 40, right, what is being advised is the medical management. And when the BMI is more than 40, right, surgical treatment is being advised. Then if you see this anti-obesity drugs like we have the Orlistat, Sibutramine and as well as rimonabant. The Orlistat, it is a pancreatic lipase inhibitor. Sibutramine, it is serotonin norepinephrine reuptake inhibitor, and rimonabant, it is a cannabinoid type 1 receptor antagonist. Now let me tell you what are the new drugs which have been approved by the FDA. So let me discuss the new drugs approved by FDA. These new drugs include number 1, lorcaserin. So if you see this lorcaserin, it is approved in June 2012. Then followed by that we have another important drug, that is Phentermine and as well as Topiramate ER. Right, Phentermine and as well as the Topiramate ER, and this has been approved in July 2012. Then we have Naltrexone and Bupropion. Right, Naltrexone and as well as the Bupropion. Right, Bupropion. Then we have lastly liraglutide. Right, lastly we have liraglutide. So these are the new drugs which have been approved by the FDA. Then followed by that, let me take up the discussion of the Orlistat. So, Orlistat, Sibutramine and Rimonabant, these are the older drugs, right? First, let me take up the discussion of this Orlistat. So, as I have said you, this Orlistat, it is a reversible inhibitor of the pancreatic lipase. So, mechanism of action of this Orlistat is, it is a reversible inhibitor of pancreatic lipase. So, by inhibiting this particular enzyme pancreatic lipase, this Orlistat will inhibit the absorption of the dietary fat, will inhibit the absorption of dietary fat. Okay. So, this is the mechanism of action of this Orlistat, and if you see the empirical formula of this particular Orlistat, it is C29H53 NO5, right. So, this is the molecular formula of this particular Orlistat, and if you see the molecular weight of this particular Orlistat, the molecular weight is around 495.7, that is the molecular weight, and this Orlistat has been approved by FDA in April 99, right. In April 1999, this has been approved by the FDA. Now, where will be the site of the therapeutic activity? Definitely yes, it is inhibiting the pancreatic lipase activity, but where is that therapeutic activity, right? Where will be the site of the therapeutic activity? So, if you see the site of the therapeutic activity, it is within the lumen of the stomach and the small intestine. Right, it will be within the lumen of the stomach and as well as the small intestine. So, that will be the site of the action of the Orlistat. Now, what this Orlistat doing? Orlistat is inactivating this particular pancreatic enzyme, right? It is inactivating the pancreatic enzyme. So, right, so this inactivated enzyme, right. So, please remember, this inactivated enzyme inhibits the hydrolysis of the dietary fat. Inactivated enzyme inhibits inhibits the hydrolysis of inhibits the hydrolysis of the dietary fat, that is triglycerides. So, it inhibits the hydrolysis of dietary fat into it inhibits the hydrolysis of the dietary fat into the free fatty acids and and monoglycerides. Monoglycerides. So, that is what will happen by the action of your Orlistat. And this undigested triglycerides. So, if you take the lipids, like we have in two forms, one is your triglycerides and the other one is cholesterol. So, this Orlistat, it will inactivate that pancreatic enzyme and it will inhibit the hydrolysis of dietary fat, that is triglyceride, into free fatty acids and as well as the monoglycerides. So, this free fatty acids and as well as monoglycerides, these are the absorbable forms, these are the absorbable forms of the fat. So, this undigested triglyceride, now because the pancreatic lipase is inhibited, so the triglycerides, they become completely undigested. So, this undigested triglycerides, it is unabsorbed, right? This undigested triglycerides, it becomes unabsorbed. Okay, now because they are unabsorbed, right, because they are unabsorbed, there will be caloric deficit, right? There will be caloric deficit, and because of this caloric deficit, the individual will have the weight loss, right? Because of this caloric deficit, the individual will have the weight loss. Now, what is the dosage of the Orlistat? So, if you see the dose of the Orlistat, it has to be given at a dosage of 120 milligrams thrice daily, right? It has to be given at a dosage of 120 milligrams thrice daily. So, whenever you are giving this Orlistat at a dosage of 120 milligrams thrice daily, it will inhibit the fat absorption by 30%, right? It will reduce the fat absorption by 30%. That is what will happen, or that is what is the effect of the Orlistat. Then, what will be the adverse drug reactions of the Orlistat? Right? What will be the adverse drug reactions of the Orlistat? Now, you see here, the fat is not absorbed. The triglycerides, they are not undergoing hydrolysis. So, what will happen to your triglycerides, or what will happen to your fat content within the GIT? There is increase in the fat content within the GIT. So, thereby, this particular increased fat content within the GIT, this fat will start getting excreted along with the stools. So, there will be fatty or oily stools. Right, there will be fatty or oily stools. Then followed by that, there will be flatus with discharge. Right, there will be flatus with discharge, and there will be fecal incontinence, right, fecal incontinence, and followed by that there will be increased defecation and abdominal cramps. Right, the other adverse effects include abdominal cramps and as well as increased defecation. So, these are the adverse effects that are associated with your Orlistat. Now, let me just have a short recap on this particular drug Orlistat. It has been approved by FDA in April 1999, and the mechanism of action of this Orlistat is it will cause reversible inhibition of the pancreatic lipase, and thereby it will inhibit the absorption of the dietary fat. And the site of action of this Orlistat action is on or within the lumen of the stomach and as well as within the lumen of the small intestine. And if you see the molecular formula of this Orlistat, it is C29H53NO5, and the molecular weight of this particular Orlistat is 495.7, and this Orlistat will inactivate this particular enzyme, that is pancreatic lipase. So, this inactivated enzyme will inhibit the hydrolysis of the dietary fat, right, will inhibit the hydrolysis of the dietary fat, that is triglycerides, and thereby triglycerides are not converted into free fatty acids and as well as monoglycerides. And these free fatty acids and monoglycerides, these are the absorbable form of the fats across the GIT. So, now the energy or this particular fat, it is completely unabsorbed, right, this particular fat is completely unabsorbed, and thereby the individual will have the caloric deficit, and subsequently there will be weight loss within the individual, right, subsequently there will be weight loss within the individual. Then followed by that, if you see the dosage of the Orlistat, it is 120 milligrams thrice daily, and this particular Orlistat will reduce the fat absorption by almost 30%. And if you see the adverse drug reactions of this Orlistat, it includes fatty or oily stools, there can be flatus with discharge, there will be fecal incontinence and abdominal cramps and increased defecation. So, these are all the important points related to your Orlistat. And having discussed about the Orlistat, let me take up the next important drug, that is Sibutramine. So, after having discussed about Orlistat, let me tell you some of the important points related to sibutramine. So, if you take this sibutramine, as already I have said you, the mechanism of action of this sibutramine is, it is a serotonin norepinephrine reuptake inhibitor, right? It is SNRI, right? It is a serotonin norepinephrine reuptake inhibitor. Okay, so that is what is the action of this sibutramine. And if you see the empirical formula of this sibutramine, the formula of this sibutramine is C17H29Cl2NO, right? This is the molecular formula of the sibutramine. And if you see the molecular weight of this particular drug, molecular weight of this drug is 334.33, right? This is the molecular weight of this sibutramine, and it has been approved by FDA in November 1997, right? And this sibutramine, if you see the exact mechanism of action, yes, it is inhibiting serotonin and as well as norepinephrine reuptake. So, because it inhibits the reuptake of serotonin and norepinephrine at hypothalamic sites, so they inhibit serotonin and norepinephrine uptake at hypothalamus. Right, it inhibits the serotonin and norepinephrine reuptake at the hypothalamus, right, at hypothalamic sites. So thereby what will happen? There will be increase in the levels of these substances, right? There will be increase in the levels of serotonin and norepinephrine at the hypothalamus. Now, because they increase the serotonin and norepinephrine at the hypothalamus, the increased levels of these substances, they will enhance the satiety. Right, increased levels of this serotonin and norepinephrine, they will enhance the satiety. So, in the sense, it will reduce the appetite of the individual. Increases the satiety means it will suppress the appetite of the individual. And this sibutramine, the advantage is that it causes reduction in the waist circumference. Right, it causes reduction in the waist circumference. And this sibutramine, it decreases, right, it decreases plasma triglycerides and VLDL. Right, so your VLDL, that is very low density lipid, it is a lipoprotein. What does this VLDL does? This VLDL, it will shift the lipids or fat from the liver into the peripheral circulation, right, into the peripheral circulation. That is what is the action of your VLDL. And not only that, this sibutramine, so this sibutramine, it increases the high density lipid. So what is this high density lipid? High density lipid, it is also a lipoprotein, but this is considered as a good cholesterol, right? This is considered as good cholesterol. Now, why is this HDL considered as the good cholesterol? Because this HDL will cause reverse cholesterol transport. Right, because this HDL will cause the reverse cholesterol transport. That means what this HDL does is, it will shift the lipids from the periphery into the liver. That is what is the action which is being done by your HDL. And if you take the dosage of this HDL, the dose is around 5 to 15 milligrams per day. Right, the dose is around 5 to 15 milligrams per day. So that is what is the effect of the sibutramine. Now if you take the adverse drug reactions of sibutramine, adverse drug reactions, it includes development of dry mouth, then constipation, insomnia, right, where the individual will have decreased sleep, and these drugs will also increase the blood pressure and as well as the heart rate of the individual. Right, these drugs will also increase the blood pressure and as well as the heart rate of the individual. So this is about your important points related to your sibutramine. So sibutramine, it is a selective or it is a serotonin norepinephrine reuptake inhibitor, and the molecular formula is C17H29Cl2NO and molecular weight is 334.33, and it is approved by FDA in the November 1997. And this SNRI, that is serotonin norepinephrine reuptake inhibitor, it inhibits the serotonin and as well as norepinephrine uptake at the level of the hypothalamus. So thereby they will increase the levels of serotonin and as well as norepinephrine at the level of the hypothalamus. So by increasing serotonin and norepinephrine at the level of the hypothalamus, they will enhance the satiety of the individual, right? They will suppress the appetite of the individual, and they will also decrease the waist circumference. And this sibutramine, it also decreases the plasma triglycerides and as well as the VLDL, and it also increases the HDL. So HDL, it is a lipoprotein and which is considered as a good cholesterol, right, and it causes reverse cholesterol transport, right, in the sense the cholesterol from the peripheral circulation, it is dumped into the liver, and the dosage of this sibutramine is 5 to 15 milligrams per day, and the adverse drug reactions of this sibutramine is dry mouth, constipation, insomnia, increase in the blood pressure and as well as the heart rate. Now after having discussed about sibutramine, let me discuss about the rimonabant and as well as the newer FDA approved drugs, that is lorcaserin and the remaining drugs.